Good day friends, I'm Dr. A.S.K. Gupta. I'm going to talk to you about the atrophic thyroid. He is a 49-year-old male who has basically come to us with erectile dysfunction. And when we investigated this patient, we found that this patient's thyroid status is grossly deranged. His TSH levels were very high in the range of 50 micro-international units per minute. And when we started giving him thyroxine replacement therapy, his erectile dysfunction started improving. But when we started doing his ultrasound, we find that this gentleman gives a history that he suffered from the carcinoma of the tongue about 3 years back, for which he was giving radiotherapy in the neck. And after that, he was alright, but his weight started increasing, but he never bothered about it. And he has come to us about a month back with the complaints of erectile dysfunction, lethargy and weakness. And we found that he is having hypothyroidism. We also found that his testosterone levels are normal. You can see that this is the right lobe of the thyroid and this is the left lobe of the thyroid. Both the lobes of the thyroid are very small in size, about 1 centimeter, and they are also very thin, and they have a hypoechoic appearance, and this is suggestive of thyroid atrophy. Thyroid atrophy should be differentiated from the atrophic thyroiditis, which is an autoimmune condition. While the thyroid atrophy can occur because of the multiple reasons, out of which pituitary malfunction, treatment for the Graves' disease, radiation, and the Hashimoto's thyroiditis are important reasons. In this patient, we find a history that he suffered from carcinoma of the tongue, for which radiation was given to him, and probably this radiation has led to radiation-induced thyroid atrophy. And this patient will need lifelong thyroid replacement therapy. Here you can see that this is the right lobe of the thyroid gland, which appears to be very small. It is very thin. Usually the thyroid gland lobe is very good in size, more than 2 to 3 centimeters in size, but hardly it is 1 centimeter in size over here. And if I try to show you the left lobe also is very small in size. This is the isthmus of the thyroid gland, which is very thin, less than 1 millimeter in size. Clear that this patient is suffering from thyroid atrophy, giving rise to hypothyroidism, and this is the reason for his erectile dysfunction and features of myxedema. And over the period of 3 weeks, when we have given him the thyroid replacement therapy, you can see that his face has improved, his activity level has increased, his activity levels have increased, he is no more lethargic, his erectile dysfunction is also improving. Incidentally, this is the carotid artery. While we are doing the thyroid scan, we find that the carotid artery is normal, but what do we see here? Inside the carotid artery, we find that this is a plaque. This is the intima thickness is increased. When the plaques are there in the carotid, this patient has the chances of that these plaques, they might dislodge from here and cause cerebral catastrophe. And these plaques form in these patients because of the hypothyroidism, leading to the increased levels of cholesterol and the LDL, which can deposit inside the major arteries as plaques. But these patients, they should be given atorvastatin-like drugs with caution because they can cause problems. The cholesterol levels of these patients, they revert to normal as the thyroid replacement therapy is given, and we will advise him that he should come for a repeat carotid scan after the stabilization of the thyroid TSH levels. I hope you like this video of thyroid atrophy. Please do not call it as an atrophic thyroiditis, because atrophic thyroiditis, there is an autoimmune disorder in which the antibodies form against the thyroid gland. In this patient, the anti-TPO antibodies were normal. In case you like this video, please do subscribe to our channel. Do not forget to press the like button and please share this video among your friends so that large number of people can be benefited. Thank you very much.